You good with note? Okay. All right, good morning, everyone. So, can I ask everyone to close their eyes for a moment? Think about, for me, the last time you or a loved one was not feeling well. You were sick. What did you do? Maybe you made yourself a cup of tea with honey. Maybe you crawled back into bed to take a nap. I'm 47. Sometimes I still call my mother to complain. But no matter what, if it was a new ache or pain that you had, I'm sure you went online to look for some information. You probably searched for your symptoms. You might have searched for some home remedies. You might have even looked for your doctor's phone number so you can get that next available appointment. No matter what you searched for, you were filling that basic human need that we all have to search for and find information. My name is Stefani Klaskow, and I lead our pharmaceutical and OTC marketing practice at Google. And I've been with Google for over 16 years now, and I've had the opportunity to watch how our habits have evolved and changed as we're trying to figure out our personal health journeys. I've also had the opportunity to work with life science organizations and to help them solve their business challenges as they're responding to these changes and this ever-evolving environment that we're living in. And while the specifics of those challenges have differed, they really all center around the one same query that everybody has. How do we evolve the way we do business so that we can better serve the needs of consumers to meet the evolving needs of patients? And at Google, we're asking ourselves this very same question. So over the next few moments, I will share from you from our perspective how we believe we can be better and build better products in service to patients and improving health outcomes. But to start, I'd like to ground us in one thing that I believe to be fundamentally true. Information is a determinant of health. Actually, information is probably the most important determinant of health. Unobstructed access to information is a way to empower patients and enable them to make informed decisions about their health. From things like, where can I get care for an urgent issue, or comparing drug prices once you've been diagnosed, or ideas for lifestyle changes so that you can not only survive but thrive if you have a chronic condition. Take a moment to think about what would happen if you asked these questions and you didn't have the answers like we've all become so accustomed to. And if so, and if we can all agree that information is a key determinant for health, the question now becomes, how do we support the distribution of that information so that we can bridge the information gap that exists, providing access to what could be life-saving information to patients in a way that's effective, comprehensive, authoritative, credible, and equitable. So here's how we see it. At Google, we aspire to give everybody the tools that they need for their knowledge, health, happiness, and success. And we're recognized that our products have a really important role to play in health-related decisions that are being made. So we've prioritized to make health information universally accessible and useful across our ecosystem. And this is spanning across everything we do, from search to Android, YouTube, cloud, Fitbit, our research, and more. And health is not new for us at Google. We have been thinking about health for the past 13 years, starting in 2008 when we developed a personal health record, which was probably a bit too early for its time, but Google has always sought to improve the lives of others, and to do that in an impactful way, improving the health of people's lives is one way that we can do that. And that has led to our effort to create Google Health. Google Health is our company-wide effort to bring to help billions of people be healthier. And this isn't just a single product area or focus. This really is the way that we're thinking about our business. High quality information and tools should be there for people to help manage their health. And we strive to offer those solutions and bring them to help patients, to help transform care delivery, to provide data and insights to public health communities, and to catalyze the use of machine learning for diagnosis of disease. And we apply these principles across three important constituents: consumers or patients, care teams, and communities. Today, we're going to primarily focus on how to bridge that information gap to patients. So I asked you to think about the last time you or someone you loved was feeling sick. Through research, we know that 3 out of 4 people are going online first when they have a question about their health. 7% of Google's daily searches are health-related. That's 1 in 14 searches, which is up from 1 in 20 in past years. We want to understand things like, what am I feeling? What can I do to feel better? What type of doctor should I talk to? Or just, am I going to be okay? And just to bring this to life for you, we saw a 500% increase in the search for, am I having a stroke, in 2022. That's increased consistently over the past 5 years. And this illustrates just how important it is to provide relevant, reliable, credible information in times of need, especially during a cardiovascular episode where time is of the essence. We also know that after the initial search, the patient journey is long and it's rarely linear. So we're striving to apply our tools across the patient journey, from our technologies to our platforms to our partnerships, to help people get the answers to the questions that they're looking for at every phase of that journey. So here's just a few examples of what that looks like. So first, when we're in that discovery phase, each year billions of people are searching for skin-related conditions on Google. And this might not be surprising because over 2 billion people suffer from skin, hair, or nail-related issues. And within that, we know that certain conditions are prevalent or present differently across different skin tones. And we also see that people now are searching more for products, treatments, and services that are specific to their skin. So for example, there's been a 37% increase in searches with the addition of for brown skin attached to that search. And we know that this isn't something that the media or medical journals has focused on. So until recently, there hasn't even been images of what these skin conditions might look like on darker tones. So for example, in our research, we were talking with patients, and we spoke with a mother of a 13-year-old mixed race daughter, and she was diagnosed with a simple skin rash when she saw white patches present on her daughter's skin. She went online, she looked for information, she was looking for images, but could not find anything that looked like what was presenting on her daughter's skin. It took almost 5 years to diagnose her with T-cell lymphoma that will need light therapy for life. And this story is pretty common, and we know that typically patients with darker skin or different skin tones are getting misdiagnosed because they're not seeing images that are related to them. So that's why we're participating with clinicians that serve patients from diverse backgrounds to build new tools in our DermAssist tool in a more equitable way. So DermAssist identifies more than 90% of commonly related skin conditions, and we're prioritizing the assurance that our technology is representative across a range of skin tones and skin types. To use DermAssist, you just take a picture of your skin condition and upload that to your computer or mobile device. You answer a few questions, and using what's learned from millions of skin-related images, DermAssist will then look for various skin conditions from that photo and share with you related images. It's not a tool intended to diagnose, because we know that most skin conditions need further clinician review or even testing like a biopsy. But rather, what we hope is that it gives patients access to reliable information so they can feel empowered to make the next step or decision in their health-related journey. And when patients move to the discovery phase, so they want to understand more deeply about a condition that they might have, it's not enough to simply provide information, but we want to make sure that they truly understand it. And because of that, we know that the how we communicate is even more important. Dr. Garth Graham, who is the global head of healthcare and public health partnerships at YouTube, captured this well when he says, effective communication is at the heart of improving people's health. And even though patients are spending about 17.5 minutes on average with their doctor, they're only remembering about half of what they hear during that appointment. And close to half of patients are going online after speaking with that healthcare provider to follow up and look for information about the decisions that were made, the diagnosis that was made, or the treatments that were recommended. And this is where video plays a critical role. Ensuring that patients have relevant, easy to understand information at their fingertips is key to positive patient outcomes. Understanding and recall are two fundamental components when we're thinking about adherence to patients. And we've learned that in our increasingly digital world, the next phase in health communication is video format, where we can connect with people and answer the questions that they have in a more easy, digestible, engaging way. We know that with the power of video, with sight, sound, and motion, you can help educate, inspire, and inform patients. And we're seeing this firsthand with the amount of health content that's been uploaded to YouTube as that increases. With all sorts of conditions, both chronic and acute, patients are coming to YouTube to find videos about their health conditions. They want to hear from patients like them, or they want to hear from practitioners or from health organizations. And access to this information in video format helps them to understand in an easier way. YouTube Health is built on 3 pillars. So the principles, the criteria that we're using to source the information, the partners themselves, which are those sources, and then the platform that we're building to provide better access in a more equitable way. Our hope is to build on these 3 pillars so that consumers and patients can better access health content across YouTube in a more reliable way. So if we take a closer look at the product itself, one of the ways that we're looking to bridge that information gap is by developing new ways to surface material. So when a customer goes to YouTube Health and they search for a condition like depression, YouTube will surface a video shelf of related content from accredited organizations and institutions, making sure that we're bringing reliable, authoritative health information out to the public. So it's simple, but innovative, and changes like these have been really meaningful. Surfacing this type of credible information in a patient's time of need has been what patients are asking for. So we're aiming to close the information gap for patients as they're looking for access to care, when they're asking, what care is available to me? So in the United States, for example, finding a doctor who takes your insurance is very important. So now, when you go to search for a doctor, you can actually do a filter for what insurance they'll take. In addition to insurance, we also want to make sure that patients can communicate clearly with their physicians. So you can also filter by what language is predominantly spoken in that office. And right now, we have over a dozen languages represented, including Spanish and American Sign Language. So across the patient journey, we're deepening our commitment to addressing those determinants of health and advancing health equity. And AI continues to be an underpinning force in doing that. Who could have imagined that these 2 letters would be so important to our day-to-day conversation? And at Google, we really see this as the next big shift. And this feels extremely important and profound because it is. But for the marketers and innovators in the room, we've been through this before, right? First, there was the internet, and we trained the market on how to use the internet to better engage with patients. Then there was mobile devices, and we trained the market on how to communicate to patients in a mobile-first world. And we will do that again with AI as it continues to become more and more important in what we're doing. But most of the things that I showed you today are already being driven by predictive AI models, even Google search. Using different types of AI gets us closer to giving people the answers that they're really looking for about their health. The trust that has grown for people in using online resources over the years has evolved. Like I shared, 3 out of 4 people are going online first for health information. Remember that day when you used to go on Google and you would just type in one word, headache, and you'd get your results? Now people type in an entire sentence with punctuation. In fact, 15% of all searches daily on google.com are brand new. So because of this, we need predictive AI models to help us keep up with that demand. And of course, there's many more sophisticated ways that we can use predictive AI models around disease and diagnosis, which can help us all in this room come together and solve the big question that we're trying to solve around health outcomes. So as I close out this session, I invite you all to join me on this journey with the third big shift of AI as we continue to evolve the way we communicate to meet the evolving needs of patients and bridge that information gap. And like Dario, I went to Bard, which is Google's experimental chat box, similar to ChatGPT, and I had them write a poem about our next summit. It took 3 seconds. The sun shines down on Dubrovnik, a city of beauty and wonder. The sea is calm, the air is warm, a perfect setting for a conference. The next Pharma Summit is here, bringing together the brightest minds in the industry. They will discuss the latest trends and challenges and share their insights on the future of pharma. The summit is a chance to learn and grow, to connect with peers and make connections. It's an opportunity to be inspired and to shape the future of healthcare. So come to Dubrovnik, join the conversation. The next Pharma Summit is the place to be if you want to be at the forefront of change. So minus the sun shining down, I think I got it right. Very good. Thank you.